Why are so many Indians, young people getting IBD, inflammatory bowel disease? The shocking truth that nobody is talking about. 20 years ago, if you look at it, inflammatory bowel disease, IBD, was rare. But now we are seeing teenagers, college students, young IT professionals, even children being increasingly diagnosed with inflammatory bowel disease every week. The numbers are rising so fast, especially in cities like Bangalore. What is happening? Why is India becoming the next hotspot for inflammatory bowel disease? This may well be happening in your body right now without even you knowing about it. Stay with me until the end. I will outline the exact reasons for this and how to fix it. When we talk about IBD, it should not be confused with IBS. IBS is where you have symptoms, you have no disease inside. So that's what a lot of people know about. IBD means you have disease, you have inflammation, you have inflammatory bowel condition, which is either Crohn's disease or ulcerative colitis. So these are chronic inflammatory conditions of the gut that can change lives forever if not diagnosed properly and not treated promptly. The shocking truth, unfortunately, is India is projected to have one of the highest number of cases of inflammatory bowel disease in the world in the next 10 years. I will share in this video why is this happening so dramatically? Why is such a rise? Are there early warning symptoms that one should not ignore? How can we control this inflammation? IBD is something that is real. You can see it. You can see the damage in the gut when we check the gut, stomach with endoscopies, colonoscopies. You can see inflammation. IBD means your own immune system is getting confused. It is overreaction of the immune system that starts to attack your gut. This starts to create inflammation. So it starts to cause multiple ulcers, variety of symptoms including bleeding, diarrhea, passing mucus, abdominal pain, repeated bloating, weight loss, feeling exhausted. So we have two conditions when we talk about IBD. One is Crohn's disease. Crohn's can affect anywhere, right from the mouth to the bottom or even around the bottom, the perianal area. It can be in the stomach. It could be in the small intestine, it could be in the large intestine, it can affect any part of the gut. Some people end up having repeated operations for fistulas, not knowing that they're actually suffering with Crohn's disease. So it's not the surgery they might need. They need to fix the underlying problem. So there is the second condition, which is ulcerative colitis. This again is an inflammatory bowel disease, but this is limited to the large intestine, to the colon. IBD needs proper treatment. It's not going to go away with any kind of gimmicks like what people try, detox rubbish that gets sold online, off-Nile, some kind of nabi oils, massaging abdomen, enemas to clean the colon. None of this will work because there is active inflammation in the lining of the gut, which requires proper treatment. So why are we seeing more and more cases of inflammatory bowel disease in our country? Why is there a sudden explosion? There are 5 main reasons, mostly linked to our modern lifestyle. Let us look at children. Children are now growing up in ultra-clean environment. So there is hardly any exposure to any kind of infections. When we were kids, we used to play outside in the soil, in the mud. We were exposed to all kinds of infections. So the immune system is built in a different way, whereas now children are growing up in very strict sanitary conditions, very clean environments. Their immune system has not learned how to self-regulate. So this immune system starts to overreact later on in life. Secondly, our diet is becoming more and more westernized. There's a lot of more of this processed, ultra-processed foods. There's all kinds of food additives, a lot of refined carbs like maida, refined sugar, all kinds of oils that is being used, a lot of fried food consumption, non-veg consumption is very high, less amount of fiber, there's not much fermented foods either. All of this, if you combine, it can start damaging the bacteria, the gut microbiome. So this then starts to trigger the inflammation, the swelling, the ulcers, the irritation in the lining of the gut. So there are other things that we are unfortunately not able to fully control. Pollution. Let's take cities like Bangalore. There is so much of traffic. There is so much of particulate matter in the dust we are swallowing, inhaling every day. There is IT sector, a lot of people are working long hours, various shift patterns, lot of stress, unrealistic targets affecting their sleep. So this kind of stress starts to affect the brain-gut axis. Chronic stress also alters the gut's microbiome. So this can, in fact, start triggering inflammation in the gut. The fourth one in our country, Antibiotic abuse. You can buy antibiotics like chocolates anywhere. You don't even need prescription. People are sometimes self-medicating left, right, and center. One-off episode of diarrhea, they just start antibiotics on their own. Children are repeatedly exposed to antibiotics for simple common colds, coughs, viral infections. These frequent antibiotic usage starts to wipe out the protective gut's good bacteria that protects your immunity. So that puts you at risk of various autoimmune conditions, not just inflammatory bowel disease. There's of course something that is in our genetic material, that is something that we might not be able to alter. So there may be already family members with inflammatory bowel disease, so there might be a genetic risk. There are certain environmental factors which we don't fully understand. So these are not just random theories. These are the patterns that we as gastroenterologists here in Bangalore Gastro Center Hospital see every day. So what are the symptoms that one should not ignore? This is really important. If you have any of these symptoms, especially that is going on for weeks, you should consult a medical gastroenterologist. If you have persistent loose motions that is going on beyond a few weeks, it can't be just dismissed as infection or food poisoning. If you are passing blood in the stool, or there is blood dripping after you pass the stool, there is mucus in the stools repeatedly, if you're losing weight without trying, if you're getting repeated attacks of abdominal pain, if you start having changes in your blood count, where your hemoglobin, your blood count starts to drop, if you're feeling constantly tired, washed out, if you're developing temperature repeatedly without any evidence of actual infection, if you're having joint problems along with your gut symptoms, if you're having skin problems along with your gut symptoms, all of this could potentially indicate that you might have inflammatory bowel disease. IBD is best controlled if it can be spotted early. So what is that you can do that can play an important role here? Well, looking after your digestive health is paramount. Having good sleep, 7 hours of good night's sleep, cutting out on processed, avoid packaged foods as much as possible. Try and increase the fiber intake gradually. This gives your gut the type of food what it requires to develop a wide variety, diverse the good bacteria, variety of fruits, vegetables, whole grains. Keep the non-veg food intake to not more than a couple of times in a week. Avoid red meat as much as you can. Quit smoking. Keep alcohol intake to occasional if you do drink. Managing stress, having realistic life goals. Constant stress is not good for your gut. Keep the sugar intake, especially refined sugar, refined carbs like maida, as much as little as possible. Remember, inflammatory bowel disease is not something that you should get too scared about. It is not a hopeless disease. There are plenty of treatment options. If we can spot early and get the inflammation properly healed, most people, in my experience, they can live perfectly normal life without having any impact on their health, because the treatment aim is to stop the inflammation, allow the intestine to heal properly, to prevent complications, and more importantly, maintain long-term inactivity of the disease. So you do not need to restrict your life. You can eat and drink as normal like anyone else, of course, within the healthy means. So try not to get fooled by various alternative treatments for inflammatory bowel disease, because this is a genuine digestive health disease, and early treatment will prevent years of suffering, which is why at Bangalore Gastro Center we have a team of gastroenterologists who deal with this properly, so that the diagnosis is proper. So it's important to get the diagnosis right, so that there is personalized treatment. There is a dietary plan. So there is a long-term fix what we need to look at. So try and look after your digestive health. If in doubt, consult a medical gastroenterologist. Thank you.